it seems so obvious, but it's only obvious when you're on that front line experiencing the problems. And I love that you're saying it's about solving problems for people. And I've always internally hypothesized that physicians should be some of the best healthcare innovators because they understand problems so intimately from so many important angles. So a front row seat and ear to the patient's problems, but also that boots on the ground reality of the physician's challenges and challenges inherent in the US healthcare system. And so much about digital health innovation today has to solve the patient's problems while working within those realities and constraints. So I guess a follow-up question is, do you feel like being a physician has given you an advantage in being a digital health entrepreneur?
I mean, that's a great question. I'd say almost yes and no. And the reason I would
Okay.
say yes to that is because it helps you, like in this particular example, it helps me think about dynamic problems. And I've basically
Hmm.
spent my entire career, maybe it's a clinical focus, or maybe it's, as I become a physician administrator, I'm working on solving operational or staffing problems, or how do I get my team to be inspired to do the work when they're tired? And, like solving all these difficult problems, I think is part and parcel to being an entrepreneur. It helps you think about things, and I've always been a problem solver that kind of tries to turn, I
Hmm.
guess I hate the think outside the box phrase. I think it's overused, but try to look at a problem from different perspectives.
Right.
And most importantly, try to look at it from the perspective that you don't have, like the perspective of another frontline person or the patient
Hmm.
or a caregiver. That is vitally important. And I think it does fuel you, like having to look at the world in different ways can fuel you to help solve problems better. The drawback for physicians is that I think that we become entrenched. We tend to become entrenched in our own beliefs, on our own data, and our own evidence. And because we have a belief that we're trying to use the scientific method to vet everything, to validate every single thing, to look at the randomized controlled trial. And then when that's done, okay, now we're going to use it. And 10 years later, when all that is
Right.
done, you vetted your solution and, but then we're really bad at implementing as well,
Hmm.
and
Hmm.
converting from that as that evidence evolves and comes out to start using it and becoming early adopters and then an early majority and moving up the diffusion of innovation curve. We're not great at that. So it's yes and no. And I've had to change my thinking to be one where I realize the value of other stakeholders and
Okay.
other people in the process. You have to really understand and break down the process and think about it from someone else's viewpoint besides your own. Being a physician
Right.
and living that can give you that viewpoint, but you really have to work harder after you develop that initial thesis, and or the hypothesis and make sure that it works for everyone else. And I think that's sometimes the hard work that physicians may not think about. So it can make your job harder, and you have to kind of get out of that mindset a little bit.